What can we suggest over and above the hormonal replacement therapy for someone who experiences symptoms of the menopause, specifically these hot flashes and so forth? So vitamin E, interestingly, has been shown to be quite beneficial at 400 international units per day, and it's really shown in randomized controlled trials to be beneficial for the symptomatic relief. I've actually been telling women to take evening primrose oil for a significant period of years, and the most recent trials, in fact, shows that the evening primrose oil in these large studies did not have an adequate effect over placebo to improve the symptoms. Other things like the more natural or naturopathic medicines like black cohosh, it's also called the black snakeroot. It's a plant that can be found in a legal plant that can be found in North America. And interestingly, it has also been shown that due to the fact that this black cohosh contains phytoestrogens, which is estrogen-like compounds, it also decreases the symptoms. But important again, to first ascertain what the risk of the patient is. So we usually use other medications in someone that cannot tolerate or where the risk is too high for the use of estrogen. And in this context, one can't use this black cohosh or these medications that contains estrogen because the risk of the adversities will still be increased. Other medications such as alpha antagonists has also been used. That specifically also works for the bladder symptoms. And venlafaxine, so Venlor as well as pregabalin. And these drugs can be of assistance if the woman, specifically the venlafaxine or the Venlor, if the mood component is significant. Just not to discontinue this quickly, so rather taper it instead of just discontinuing it because it can lead to dysphoria, significant dysphoria if you stop it abruptly, as can all the other medications such as estrogen as well. So we tend to taper this dose when we reach the 10-year period.